Hi, everyone. My name is Omar Jai. I'm a second-year medical student, a member of the DIH co-founding team and the inaugural DIH student fellow. So I have the pleasure of introducing our panel for this afternoon. So if our panelists can start making our way to the stage as sort of read off your names. Our panel will be moderated by William Brown, the IT director here at Mount Sinai. We have Sarah Pesce, who's the COO of Lab 100, Gil Addo, who's the CEO and co-founder of RubiconMD, Tanvir Islam, who's the CEO and co-founder of Errunds, Ivelyse Andino, the CEO and co-founder of Radical Health, and Clayton Banks, CEO of Silicon Harlem. So without further ado, here's your panel.
Good afternoon, everyone. Thank you again for coming to our DIH launch. My name is William Brown. I'm one of the co-founders of Diversity Innovations Hub, and we have a wonderful panel here for you guys to hear from. And I will just jump right into it and get started to make use of the time and get you all the information we can get you. So I'd just like each of the panelists, I'm going to go one by one, to briefly state what you or your organization does and your use for innovation and how it is you came to be in the role that you are.
Well, thank you, and thank you for the whole DIH team, and William and Gary, thank you for inviting me. My name is Clayton Banks, Silicon Harlem. I'm the CEO of Silicon Harlem and co-founder. My co-founder is actually in the audience, Bruce Lincoln over there. He's 100, so don't worry about him. He's okay. But I have devoted, and Bruce and I both have devoted the rest of our careers to trying to bring parity to communities, and our prism is through technology. So we focus on technology and innovation as a way to help individuals in their community get more access and exposure to not only tech and innovation, but to opportunity. And so we created Silicon Harlem to be that catalyst, and it's working. We've been able to generate jobs. We've been able to attract over $50 million into Upper Manhattan. We've been able to literally build a hub for startups, and you might have read about the great fund that has been created in Harlem. So we're seeing it work, and we're now starting to replicate it around the country and other communities, including the Bronx. But anyway, that's another story. And so I'm proud to be here and also being invited to be on the board, because I think that one of the key areas of our future is health. In fact, I've predicted that it's the next trillion-dollar industry, because as the doctor earlier said, the same medicine doesn't need to go to the same people. Sometimes you have to break it down to the actual individual. And I think we have that great opportunity with some of the breakthroughs we've had with our genomes and everything else. So I'm very excited to see how technology is going to allow us parity among health outcomes, and also some of you will live longer. So let's see what happens.
That was a nice segue into the Bronx. I always start these with I'm born and raised in the Bronx, and I say that, yeah, BX all day. But I always say that with intention, because where I grew up, for me, I just wanted to get out the hood. That was so important to me, and the way that I thought that I could do that was in healthcare. So I went and I worked for the big pharma companies, and I worked for doing bio-oncology therapeutics and marketing around that. And in many of the ways, right, I saw innovation firsthand. We were creating new oncology drugs. My job was to train physicians and researchers on those new drugs so that they could then use a peer model and train others. And so I thought I was at the forefront of innovation. At home in the South Bronx, right, I was in my community where we lived and breathed and worked. And if you know anything about the stats, and I think the same is true in East Harlem, right, where your zip code determines your health beyond your actual genome and your structures, right? And where I was from, even though we had those like negative connotations, whatever you call them, there's a really strong sense of community, a really strong sense of resiliency. And so by day, I'm managing millions of dollars. I'm at the forefront of innovation. But at home, I had a really hard time because it just wasn't equitable. And so I decided I wanted to do something more. And in that traditional route wasn't going to work for me. So I went into health tech because that's, again, where innovation is. And now I'm a little closer to the ground. And in that process, kind of saw the same things. So while I was creating apps that people could use in lieu of actual, like, you can get like a Fitbit or an iWatch, I still had the same problem where in my community, we had a lot of people and a lot of power, but didn't have access to the innovation. And quite honestly, the quality of care was lacking. And so I founded Radical Health with this idea that in our communities, we could actually have equitable care, but also it could be redefined in ways that transcend beyond just the clinical experience, that really began to incorporate where we live, how we live, our human connections. And through that, Radical Health today, we look at health equity through meaningful conversations. So we combine the people power, where we have real conversations, like face to face, about health and defining that on a really local level. And then we combine that with tech. And so what we've built out is a Know Your Rights for Health app, which uses AI and machine-based learning to help people ask questions, both before an appointment, during, and after. And so I love the earlier presentation because we talked about, what happens if you go see a dermatologist and they don't see patients like you often. One of your first questions should be, how many Black women are you treating, and have you treated this before? Or if you don't speak the language, we can all ask for translators. So what we really do is combine the people power, the conversation, the lived experiences with tech to make sure that we have equitable access to care.
Son? Cool. Hey guys, how's it going? I'm Tanvir. I'm also from the Bronx.
Yeah, no, you seem really excited.
It's a party. That's when I joined. So I'm Tanvir. I'm from Queens, actually. I was born in Brooklyn. And my story is ridiculously diverse. I've been in finance, I've been in fashion, I've been in cloud-based ERP companies. I've been all over the place. And I think that's the one key thing that sort of threaded my life together is the whole notion of impact and scalability at the end of the day. And going back to that, being able to understand the end user is very important to me, and being able to solve problems, complex problems, and pain points. That's always been something that's been near and dear to my heart. And I guess to get things started, to kind of talk more about like what I do and why I'm here. For starters, thank you, DIH, for having me here. Just wanted to talk more about what I built. So, just kind of growing up in urban neighborhoods, Queens, Brooklyn. I was born in Brooklyn, moved to Queens. I started noticing how difficult it is for local brick and mortar businesses to be able to scale up. Societies are changing, communities are changing. We make jokes about how like people are drinking kombucha now, and they're not wearing socks, and they have like yoga mats underneath their arms. They live in Brooklyn, what have you. However, you don't really think about what's been displaced by that happening. When the Starbucks opens up in a certain community, be it Williamsburg, be it Bushwick, there's a lot of displacement that's happening to the fabric of New York City. I noticed that early on. I moved to Jersey, came back to New York, only stayed there for 3 months for obvious reasons. I'm joking. And so kind of coming back to New York, maybe sort of like see these things in a much more prevalent light. Started to notice how difficult it is for business owners to adapt in this day and age. And so I co-founded Errunds. And we're an AI-powered online community marketplace connecting busy shoppers with local brick-and-mortar businesses. Think of it as Amazon for your community, right? So like we allow you to order anything. First of all, we allow you to be able to find anything you want according to who you are, where you come from, what you're interested in, your financial threshold, or your price tolerance, and we connect all of that in your neighborhood to you. So that way, this person who happens to be Hasidic, kosher, is a lawyer, super busy, would now be able to actually find all the kosher products in their community and be able to buy them in such ease and convenience. That way, we solve their pain point and we scale up local brick and mortar businesses. I think it's Jay-Z who says something like, we don't know who we are. We don't know who we may be. Maybe I'm the one, or maybe I'm crazy. I definitely am crazy, as a given. And I'm glad to say I've got 10 other crazy people on my team with me. Super diverse team. From Peru, from Ghana, from all over Southeast Asia, Malaysia, Singapore, what have you. And we got together and we're working on this concept. We built an ML-based recommender system. We're building an AI heat map. I'll talk about some cool stuff about that later on. And we're growing. We have 4,000 businesses in our platform. Started this a little over a year ago. We got an acquisition offer to sell. Not going to do that anytime soon. And we're just growing. And our notion here is to really change the definition of community. and to really revolutionize the way we shop in store. At the end of the day, put a dent in what it means to live in a community.
Hi, welcome. I'm really excited to be here, and I'm from the Bronx too, so Barchester in the house. Oh, yes! But I just want to talk about Lab 100. I'm the CEO. My name is Sarah Pesce. I've been at Mount Sinai many, many years. Lab 100, the actual genesis, I'm going to give you a little bit of context, was us kind of coming together and deciding under Dean Charney, who's super innovative and really told us here at Mount Sinai it's okay to fail in order to succeed, and gave us that permission or created that culture and environment for us to do that. So what we decided was we wanted to look at the other end of the spectrum, really at health and wellness and not sick care. And how could we do that? We need to really look at the data or the phenotypic information that we're collecting on different individuals. Right now in healthcare, we have a lot of information on electronic medical records and claims data, but we actually don't have a lot of information about the way people live in their everyday communities. So we wanted to create a place that we do that and think, why would anybody want to come to a health system or an ambulatory suite to give us that information? We thought, why don't we create for them a really unique front-facing clinical experience where they actually enjoy the experience. Many people today are disenfranchised, they don't really enjoy the experience, so we thought very long and hard about doing that. So we came together as a diverse team. We decided what our concept was going to be. We were going to build within a few months a biometric screening assessment where patients come through, and during the journey, they learn things about their sleep, nutrition, physical activity, mental health, their body fat, muscle fat, visceral fat, things like executive function, cognition testing, your memory, processing speed, attention, flexibility, things that we thought they would find useful and interesting. And then on the back end, we get to pull this amazing amount of information about how they're living and breathing in their everyday space. What we didn't realize at the time was that we kind of hit it out of the ballpark. We went open. We decided to use startup methodology where we created a prototype. We did that right here at the main hospital. We went live. We had over 200 patients come through as beta testers. What I like to think the success or the secret sauce is that we brought all the key stakeholders under one roof. So we had the patients or a consumer, we had the providers who are very burdened right now with technology. Sometimes it's a little bit of technology fatigue. You aren't really getting to do what you like to do in healthcare, where you want to kind of have a front to a facing experience with the patient. You're kind of very often spent scribing and typing, and we see this is a great opportunity where technology does what it should do. It fades to the background and allows me to go back to talking to the patient, educating them, counseling them, and me going able to, or other providers to working up to the level or letter of our degree. For innovators and researchers, I'm not sure if everybody knows, but Mount Sinai is amazing. We're one of the largest recipients of NIH grant funding. So this allows us a great opportunity to do a lot of big research with all the de-identified data that we have on the back end. And for new innovators, we want to use this as a test bed so that we can try new products out, get rapid feedback. I think it currently takes about 17 years for new innovation in healthcare. So we looked at this as a space that could rapidly accelerate that process so we could know, does it work for the patient? It doesn't work for the patient. It works for the provider, the healthcare system. It would give us that immediate feedback of like, what are the problems with healthcare access? How can we impact? How can we really activate a patient? Could we start to get people to take better care of themselves? Because we know this, there's a ton of money in healthcare. We spend the most compared to other industrial nations, and we still have some of the poorest outcomes. So we really need to look at the other end of the spectrum and how can we prevent people from becoming sick? And we think what we've created is a great opportunity where it activates people, it gives us real-time data and feedback so that we could start to make better decisions as a partner with our patients.
Hi, everybody. My name is Gil Addo. I'm co-founder and CEO of RubiconMD. First of all, thank you guys. Thanks to Dr. Butts and Omar and the team, the Diversity Innovation Hub for inviting me here to chat. RubiconMD, we're a 6.5-year-old health tech platform on a mission to democratize access to medical expertise. We do that through a really simple platform. What we do is we're connecting primary care clinicians to specialists for what we call e-consults, which are text-based opinions focused on enhancing access to specialist expertise. Business was inspired by some personal experience I had. So I have my family on my mother's side is from Barbados, and I had a grandmother who was based there who traveled from Barbados to Boston for surgery on a brain tumor. She then spent 5 years going back and forth on all the management and post-op treatment of the tumor. So what I was really interested and inspired to do was to build something that connects the expertise that sits at incredible academic medical centers like Sinai to the communities where it's so desperately needed and valuable. And that was the idea behind RubiconMD. We're a venture-backed business. We've raised a little over $20 million to date to get out to 36 states, supporting about 5,000 primary care clinicians. We're proud partners with Mount Sinai through a program called DISRIP, where we support, I think, roughly 300 to 400 primary care clinicians across the city in several neighborhoods within Manhattan, as well as the Bronx, Harlem, where I live, and Brooklyn as well. So proud to partner, excited to be here to chat and to share more.
Great. Don't we have an awesome panel? Please give our panel. So I'm going to go off script a little bit because I'm not going to let Sarah and Ivelyse get the Bronx shine to themselves. I'm from the Bronx too. All right, let's get that in. All right. Okay. And I'll just go right to the questions. I'll start with you, Clayton, and we'll move back and forth throughout the panelists. What lessons can you share from your experience in addressing inclusion while focusing on racial and ethnic minorities and underserved populations?
I think a couple things. And first of all, there's a lot of PhDs in here and MDs in here. That's pretty cool. I told my parents I was a PhD, and they looked at me like, "What?" But anyway, it was hard to describe, right? So anyway, the things that I think make a lot of sense for any community, frankly, but certainly those who've been falling behind for a variety of systemic reasons, is that you have to have 5 components. And I mentioned MDs and PhDs because some of you might take this down as a note. There are 5 components to building an ecosystem that creates opportunity, creates access and exposure, and can future-proof your community. There's 5 things that will help with that question. 5 components. One of them is you have to have the electives at the table. The electives can help clear the way with both legislation and policy and things of that nature, as well as help with resources. Second, you need to have the private sector involved. As evil as they may be at times, they are resourceful, have a lot of solutions, and are ready to go. You need to have the academics in your community. For us, we are lucky to have 14 colleges in Upper Manhattan. Hello? Everybody hear what I'm saying? 14 colleges. That's more than most states, including an Ivy League. So we have great resources in Upper Manhattan. But we also work for we work with NYU and Fordham and all the other universities around, frankly, the country. The fourth voice at the table must be your stakeholders. These are the hospitals, the churches, the YMCAs, all those institutions that are touching the community. And finally, you want to have the citizens' voice at the table. Our objective at Silicon Harlem is to create that communication level. We sit in the middle of that wheel, and as a result, we're able to, one, get the lay of the land cleared, and 2, the best solutions to approach those disparities, whether it's a problem or whether it's something that's not correctly administered.
Okay. Ivelyse, you want to take that question as well? What experiences can you share from addressing, challenges in minority and underserved populations?
Yeah, I mean, I think we know the challenges, and I think that's one piece. And I think I'm super intentional about language. We can call them disparities. I mean, but really what we're looking at is equity, right? So there are the structural biases, the personal biases, and I think those are really real. The challenges, I think, is especially when we're doing this work, it's really easy to say, us in this room, we can make decisions. I've sat in many boardrooms as like the only woman, the only person of color making decisions for a community, and never really going to the people and asking them what they want, what they need. And I think we forget that like lived experience is probably some of the most valuable pieces. And so in terms of like addressing this, right, underserved communities, whatever you look at it, we really look at it from a people first perspective. That those that are on the ground, those that are directly impacted, they might not have all the letters, but they know first and foremost what they need. They know what they want. And then when we look at it, from an innovation piece, I mean, there are, again, a ton of challenges, and I really just want to commend the folks here at DIH for pulling this room together. I think even in the audience, when we start to talk about innovation, technology, health, like this is probably one of the most diverse audiences I've seen in a very long time. But it's important that we all like work together, support one another, and really listen, to the two roles that we play. For those of you that are in this audience that are both, working in the system, but also live in the experience, I think those two roles are really important. And we really just try to like channel that all in and really put people first in creating these solutions.
Excellent. Gil, I'll come to you now. Would you share your thoughts on and observations on the evolution of health tech and digital health and advancing health and healthcare?
Yeah, absolutely. So I think so the overall.
Is your mic on, Gil?
Is it?
Oh, yeah.
Can you guys hear me?
Okay, go
Let me
ahead.
just put this a little closer. So the entire idea of digital health, which has become a buzzword, is can you provide better care at a lower cost by employing technology? And I think when people look systemically at healthcare, they always think about what are the things you can do to push the bounds of modern medicine. So some of the awesome things we just heard about, which is how do you find better ways to treat things? How do you find treatments for these new diseases? How do you start to advance rare diseases? So in a prior life, I was a healthcare consultant for pharma and biotech companies, so doing the Lord's work in that space. And I think people look at that and they see that space as, that's where innovation's happening. That's how you're moving the needle by finding these new treatments, these biologics, these things that, end up solving rare disease. They help with different conditions. And I think where people miss the boat is that most of the challenge around the healthcare system is how do you get those things out to people that need them? So how do you solve for that gap that's getting those technologies and those solutions to the people that need them? And how do you do that in a cost-effective way, right? So, and we all know healthcare is 20% of GDP, and it's growing, and you can't continue to push more costs into the system. And that's frankly not the biggest challenge we have. The challenge is how do we provide the tools and solutions that we have out to greater numbers of people at a cost that the system can support. So I think that's what digital health is. I think that's why there's been such an emphasis on it. If you look at the numbers, I think Omar can probably get me where the real numbers are, but Rock Health surveys people every year and looks at the amount of funding into digital health. And one would expect as you move through certain cycles, particularly around election years, that funding would drop, and when you have uncertainty around policy that it would drop, but it's continued to go up. And the reason it's continued to go up is because there's broad consensus that you need to figure out ways to drive value-based care. You need to figure out better ways to get the same tools and solutions out into the communities where it's necessary. And I think the way we think about it is you don't put the onus on the patient for these things because that solves this narrow kind of piece of the problem where you end up with people call the worried wells, where these people who know that there's an issue, have the right literacy, have the right educational background, and understand enough, and they are empowered enough, they will go and they will move heaven and earth to kind of find the solution, and they become the vocal patient advocates. And those people are incredible for the system, but they don't represent the vast majority of people that are responsible for the costs in healthcare. And so what we've thought about is how do you work within the existing healthcare system? How do you empower the clinicians? How do you empower people that can advocate for them and not put the onus on the patient to know that they might have COPD or to know that they might have this disease area, and then to go to the clinician to demand that, you know, they look further into it, that they give them the right access to these solutions. But how do you work within the infrastructure to make sure those things are presented to those populations at the point in which they need them?
Great. Sarah, you want to take a stab at that one? Your thoughts and observations on evolution of health tech and digital health?
I mean, I definitely echo many of the same sentiments, and I don't try to make any types of assumptions or biases or prejudice. I don't want to make any assumptions that I understand what somebody, how to spend their money, because I think it's very challenging right now. If you have a $2,000 deductible, it's why other companies or external innovators are trying to get into healthcare, because we know that there's a ton of waste and there's a great opportunity to make money. And I actually am very nervous by them doing that, because as the earlier speaker mentioned, like the Hims and the Romans of the world, like they're trying to circumvent the evidence-based medicine practice because they provide convenience. And that's where we kind of probably stopped a little bit and should have kept our eye on the consumer experience within medicine, so that we could provide access, because that's access and barriers. We have to eliminate those, because that is probably what's causing many people to not utilize the system in the right way and then overutilize it downstream in the wrong way.
Yeah, excellent point. Sarah, I'm going to stick with you on this one and ask you, how can biometric data be harnessed to catch disease that goes undetected, especially in communities with high rates of mis- or underdiagnosed issues?
Yeah, I mean, we're trying to test that theory out. We want to see if we can collect this comprehensive set of information on patients and start to become more predictive and less reactive by looking to see, are there subtle features that patients are showing that historically in healthcare maybe we just were overlooking. During a typical visit with a primary care provider, and we're not replacing primary care providers, we just want to enhance the experience. You have a time crunch. You have a certain amount of minutes with a patient. Many times you're spent scribing, back-facing a patient. You're trying to go over those big ticket items, cancer, diabetes, high blood pressure, CAD risk, and the technology was, again, a little bit of a burden and took our time away from getting to talk to the patient and really letting the patient verbalize what they want to discuss. Maybe sleep, nutrition, physical activity. You mentioned your zip code is more a determinant of your health than your DNA. We need to kind of go back to that, providing patients with the right information. And I'm hoping that through extracting this, then we could just have that nice dialogue and conversation with them, and so that they can, trust us and look for us for guidance in
Great.
prevention.
Thanks. Tanvir, any thoughts on the use of data to support your innovation that you think can work with and impact communities?
The D word, data?
Yes.
Sure, I'll talk about data. A couple of things to sort of mention here is artificial intelligence. Just mentioning that it's almost like a buzzword nowadays, right? You can't go to a conference without someone talking about AI. And more often than not, it's always about how AI is going to ruin the world. We're going to build like robots, it's going to end up automating jobs, and people are going to be living on the streets, and we're not going to have anything. And we're going to have to learn new skills and what have you. But what if I were to tell you we're using AI to solve food deserts? How is that possible, right? Well, think about it this way. Artificial intelligence in some capacity is like an overarching circle, and you have things like machine learning, deep learning, all that great stuff that fall underneath it. And a lot of the things that we noticed was that, in certain populations in New York City, we're using AI to create some pretty cool products. However, you have a ton of urban problems that are not being solved. Food deserts is one of them, local economies growing is another one, what have you, and the list goes on. And the way we target things like food deserts is that we look into populations, we look into groups of people, and we jump into their consumer behavior. We jump into their psychographics. Now, what we do is we end up making a list of all the things that they typically buy in a community. All the things they want to buy in a community, as well as their price tolerance. And so with that amalgamation of data, we then have a good amount of understanding of where they stand, and then we do the added part of then connecting them to all the local purveyors around them for them to be able to find access to healthy and nutritional food. And so, this is going to be a huge shameless plug, but I passed out a couple of cards with QR codes on them. We created a personalized shopping companion that literally does exactly what I just said right now. And so if you guys zap the QR code on it, you guys will be the first 100 in Harlem to see what I'm talking about. We literally created a system, an inventory management system, where we connect your interests to all the inventory in the community. And so if you happen to live in the South Bronx and you're looking for healthy and nutritious food, and you don't know where to go because you have like a Burger King and a McDonald's right next to you, we will show you the hole in the walls. We'll show you the bodegas you can go to pick up your fresh fruits and veggies. And so that's one way, in one capacity in which we're using data, more specifically artificial intelligence, to be able to impact the consumer and create a smarter city. Now, on the flip side, what about the local brick and mortar businesses? If you think about it from that perspective, it's two sides of the same coin, which is pretty awesome. So if you help people kind of get access to businesses to find fresh fruits and veggies, aren't you also helping the local brick and mortar businesses as well with traffic? That's exactly what we're doing as well. And so in some capacity, you have these brick and mortar businesses that are being, more or less overshadowed by a Whole Foods, a Pathmark, a Seatown, what have you. Now these bodegas and what have you now have the ability to be on the map, now have the ability to scale up, and now also have the ability to know what products to have in their store as well. It doesn't make sense for them to buy everything under the sun, so focus on the things that your community wants. The people in South Bronx, your community in South Bronx may want different things than your community in East Williamsburg, right? Like you're probably gonna want more, sort of White Claw, seltzer water, and kombucha in East Williamsburg, and that's something I've been seeing because we've launched there. You're not gonna want that in the South Bronx, and so at the end of the day, by being able to tailor and personalize a community, enables you to be able to not just solve a problem, but have a lasting impact with data.
Excellent. Gil, let me go to you on this. What are your thoughts on tech as an enabler? And share an example if you have one.
Tech broadly as an enabler. I think the opportunity for, and obviously we built a business around tech to enable, so I'll give one use case from kind of what we do, and then try to zoom out and provide a little bit of additional context. But at the core, so we did a lot of work in 2018 in California, 2017, 2018, supporting Medicaid populations. And one of the challenges that they had was they expanded Medicaid quite significantly within California. And so you had this whole wave of people that were newly insured, which was incredible. But you ended up with a lot of people that needed care in a healthcare system that wasn't actually equipped to handle that many people inside of the state of California, right? So all these people had insurance, but it wasn't like there were more physicians, it wasn't like there were more hospitals, it wasn't like there were more specialists in each area to be able to serve those groups. So how do you build a solution that starts to provide access, thought differently, access to those people who are now newly insured and who now can actually enter and access the healthcare system, or a system that structurally doesn't have the infrastructure to handle that many new lives. And so this is kind of the mandate of a group that ended up investing in RubiconMD, the California Healthcare Foundation, was to go and find technology offerings to better enable access for those groups. So one of the challenges, which is kind of the use case around RubiconMD, was areas where there are very few subspecialties. So the network inadequacy is the formal term, but where you don't have a reproductive endocrinologist or you don't have a pediatric dermatologist within 2 hours in Central California. And so what they did is they gave the primary care clinicians, physicians, and physician extenders, so nurse practitioners and physician's assistants, they gave them access to the eConsult platform. And what they would do is they would say, I've just seen this patient. We don't have a pediatric dermatologist within 2 hours. They'd have to travel up to San Francisco. But I can upload anything that's relevant to this case, and I can take a picture of this rash, and I can just send it through to this platform. And we have a network, we actually have a national network, but even across California, we've got a network of pediatric dermatologists who can look at that question, and they can provide an answer within a couple hours. And so they'll look at it, and they'll provide a response back, and it comes back in a couple hours. And what we've found is that half the time, so these are typically very simple moles or rashes, half the time you don't need to send the patient to the dermatologist. So you can just get this cream and the issue will resolve. We see the same thing with a lot of lab-based specialties where they'll put in the labs and the specialist can look at it and say, this isn't that concerning, we'll send back the response, and this patient can be monitored in this way over the next couple weeks. And half the time you don't need to actually go see the specialist. But when you do need to go see the specialist, the care is expedited and you know you need to go see them sooner. And so within these, call it like 2-hour radius outside of Northern California, they're able to essentially use technology to not substitute, but augment the infrastructure in terms of pediatric dermatologists or endocrinologists that they just don't have physically there. And then they can still expedite care. So I think that's one example for us of tech enabling better access. An example outside of RubiconMD is we work with partners around behavioral health. And it's very challenging because in a lot of settings, behavioral health is one of those areas that primary care clinicians just don't feel comfortable prescribing the drugs that are necessary. And so when they find out that a patient has a behavioral mental health condition, they're now like, well, I don't know what to do. So they'd rather actually, this is unfortunate, but we understand the personal implications. They'd rather not know because the second they know, they don't have the resources or the means to treat it. And so they bring in a technology partner that we work with that says if this treatment is recommended, they can help you assist through telemedicine with a behavioral health specialist who can help guide you on how to prescribe this treatment. And I think that's in an area where vastly underdiagnosed and then undertreated conditions exist. So we see both of those situations. I think those are ways in which technology is helping to augment. And I think just broadly speaking, when you zoom out, it's the way in which you take technology that allows you to serve larger populations with the same infrastructure that's existing. So you can get out to these communities and you can leverage the existing infrastructure to be able to get these people the care that they need and deserve.
That's a great example. Okay, Ivelyse, I want you to describe the importance and how your organization, what you do in your role, engages underserved communities and communities of color.
Yeah, so I think, at the forefront, Radical Health, right? We focus on health equity in these historically marginalized communities. So really, we look at the intersection of like poverty, incarceration, and then any other group. So LGBTQI, folks who have been impacted by the justice system, those that are undocumented, disabled folks, veterans. Like we really look at anyone that when you walk into a door, right, whether it's visible or invisible, you haven't necessarily been cared for or centered in terms of care. And so for us, when we engage with these folks, I think, it's really important. Like what we do is we really believe that while we could have built any kind of tech, and we think tech is super important, it was really important for us to include people. And we really center like this people aspect plus tech to create this change. And so a lot of the work that we do, we use indigenous circle practice, which is where we meet in these like workshops. We either host them ourselves in these communities. So we're hired by the Obama Foundation is one of our clients. We're hired by government, payers, providers to facilitate these conversations. And so we either have those conversations in the community, or we train facilities on how their staff can facilitate these conversations. So using, we're currently doing a big project right now in the South Bronx around the opioid overdose epidemic. How do we bring community members together to talk about this? And then we get to connect that with the tech. So one of our other projects on the tech side is working with Black and brown pregnant people and helping to reduce the maternal mortality rates that we see here by helping them ask the questions. So for us, the way that we engage is one, just making sure that we are culturally competent. So in terms of my team, obviously I'm the CEO and founder, but my team is incredibly diverse. We hire locally, so when we look at folks who are going into the community, we make sure that they represent the community in which they're training or they're working with. We make sure that everything we do is, trauma informed and centered. So again, those indigenous practices. The piece that I'm missing is that we also do this for providers. So we've done, healing for healers, right? So how do we connect the two pieces? And I think you brought up a really important point. This isn't just putting the onus on people. but really incorporating all of the facets. So if you look at all these circles, radical health really operates between like the community, the health system, and tech, and bringing them all together. And so, I mean, it's super unique when you ask, you know, who's done this before? I'm hard pressed to find examples, but what we've been able to show over and over again is that, you know, 87% of people who engage with our program come back for another session. So this is, you know, the hardest to reach. People call it the last mile. Like, we're working with people who want to be there and like extract real value. But then beyond that, like 98% of our participants would recommend our work to a family member or invite other people. And I think what we're really trying to do is we're at the forefront of like letting people lead and meeting them where they are. And then ultimately incorporating technology as a way to support this, and not in replacement of people, not to replace the existing connections or the clinical services or all the things that I think everyone in this room is working towards, but really to amplify that and to do so with this equity lens, because we really believe that no matter who you are, we all deserve access, we all deserve quality care, and we all deserve to be heard and seen, and ultimately that is like our future.
Absolutely. Clayton, you want to take a stab at that? The importance of how your organization effectively engages underserved communities of color?
I'll build on Ivelyse. Just to demystify something, we're not an organization, we are a for-profit company. So let me be quite clear about that. We are a for-profit company because we are not interested in raising money like that. We are very much interested in business models, but business models that are fair and easy and certainly bring equity to communities. So when we think about some of the things that we focus on, one of them is the fundamental denominator here, no matter what you guys are talking about, whatever I'm talking about, the reality is that 40% of people in Harlem do not have a broadband connection in their home. So if they even want to be a participant in some sort of study or research or even manage their own health records, they can't do it. So if we want to really accelerate what's happening in the medical world, we got to get everybody connected. Otherwise, we're wasting a lot of time. So we, as a company, as a for-profit, are very focused on building networks that get people online and can do telemedicine, for example. And we've done that. We've actually built in the East Harlem area. We're building now and acquiring a big network in Central Harlem. And we are going to be the next Comcast, if you will, because if you really want to bring fairness, I couldn't even fly to Ohio yesterday without the internet. I could hardly get to this place without the internet. So we got to be realistic here. All the fancy words I'm hearing, which I love, aren't going to get us anywhere to equity if we don't make sure everyone is connected. So let me just quickly say that the couple things that we've done in this area, for example, we just graduated a class of at-risk youth out of a public housing, you know, a NYCHA, right? St. Nicholas houses. We took kids out of that, at-risk kids, gang members, et cetera, to come and basically create an agency that could serve their fellow neighbors. And what we taught them was how to create a website from scratch using, you know, our own methodology and teaching them how to code. And for the first time in the history of that particular public housing, but I think public housing across the nation, across our city, launched their very first website designed by the kids in that housing for the housing, and it included a health component. And I think those are the type of fundamental things we're going to have to do, because all of you are doing the right thing at the right time, but we need more voices and more people coming from different places to add their voice to what's happening in the health area.
Right, absolutely. Absolutely.
Can I mention one other thing?
Yeah, sure.
Just very quickly here. So one of the things that's interesting about Harlem is that to me, it's the most accessible part of Manhattan. 6 bridges come into Harlem. People probably don't even realize that. 4 of them are free. So what's the way people come into Manhattan? It's through Harlem. Why do we have a high propensity of asthma? Because of the particulates coming from those vehicles and everything else. We have to start looking at infrastructure for equity. And I think we're at this great moment, 4th Industrial Revolution coming fast and furious. And if you don't know about spatial computing and quantum computing, you better bone up on it if you're in the medical field. It's going to radically change everything. But we have to solve these problems to the point of humanizing technology. We have to solve them by utilizing not only our great current skilled people, but bringing up kids that will 100% understand what they have to do for their lives and for the fourth industrial revolution.
Absolutely. And with that, they'll bring those innovative ideas that we
That's
need
right.
to solve those problems. Tanvir, let me ask you, what advice would you have for entrepreneurs building technology-driven solutions that they may demonstrate, a social responsibility?
Right. I'd say off the bat, talk to people. It's very important. Oftentimes whenever we're building technology or thinking about technology or conceiving of or ideating technology, we kind of do it in a silo, right? We feel as if we know everything about who we're building something for, and we feel as if, with just a bit of marketing and what have you, if you paid social media ads on Facebook, we'd be able to target the people we're trying to target. However, at the end of the day, the whole notion of being able to do customer discovery and really understand who you're building something for is ridiculously paramount, right? In my team especially, what we do is we do a lot of user flows and we do a lot of design thinking. What that refers to is we do a lot of thinking about why people do what they do. We literally try to put ourselves in their feet in every single given day. Think about the typical bodega experience, walking in, sort of seeing the guy behind the grill, seeing the cat on top of the bread, things of that nature. Well, they got the joke. You kind of go in and you kind of like see all of that, right? So how do you augment that experience? How do you make that experience so much better for the average consumer that they end up wanting to do it? So essentially what I'm trying to say is you jump in small, you micro-target, and then you scale up. And as soon as you're sort of done targeting one pain point and you really quell it, you kind of grow that way. And you grow using network effects as well. I'll give an example as to like how we thoroughly messed up with that initially and what we learned from it. I think off the bat, we figured that people genuinely just want to have a better way to shop. That's genuinely what we believed initially on. And we were building this Amazon type of concept in which people just go in, they buy whatever they want ahead of time, and then leave. However, kind of doing customer discovery, I realized that many people won't even walk into a bodega, particularly because a lot of the common opinion is that they're unclean, partly because all these, sort of food items are all over the place. It's not categorized as like an Amazon warehouse or like a Walmart supermarket or something of that nature, but best believe some of the most healthy and nutritious foods are there in a bodega. It's really all about presentation. It's really all about amplifying the user experience. So after we kind of understood that point, we realized that it's not because it's unclean that people don't go in. It's because when they walk in, they feel super flustered. It's like everything's all over the place, right? And so, not to mention long lines and what have you, you never really want to walk in. And so what we did was we noticed that personalization would really solve that problem. So our team went, hard at work, and we built some SQL-based recommender systems, a machine learning recommender system that we're going to be deploying out very soon as we get more data to essentially personalize every experience at a bodega. So in that way, you kind of know what's in your community. You know essentially what's there for you, what products are there for you, whatever is gluten-free and dairy-free and kosher, really just made for you. So then that way, we kind of essentially tailor the community for you. And that's an example of like a way in which we sort of like iterated our process and really talked to a bunch of people and kind of like stepped out of that silo of just building without measure. At the end of the day, team will tell you guys this all the time. There isn't a day that goes on without me kind of jumping onto the whiteboard and drawing, BMG, build, measure, and grow. Because that's constantly what we do. We build, we see if it's working by measuring it, and then based off of that, whether double down or we iterate or we pivot. And that's kind of the growing aspect. It's kind of essentially, in some capacity, a way in which we iterate and grow, and we think in ways essentially to augment the community experience. Now, sort of like on that notion as well, when we're talking about Errunds and our concept here, we really try to make it so that communities, in a nutshell, really sort of have this influx of data that's coming in as well. So, how do you make it so that business owners understand what to sell, what not to sell? Because at the end of the day, they're also in a silo as well, funny enough. So now by solving that one problem, we kind of share the data to the other side, and now business owners know essentially how to target and really get to their users that much effectively. And kind of a side note here, going back to like the advice for entrepreneurs and how to essentially, build technology companies and what have you, one of the key lessons I learned early on is the notion of mentorship and how important that is. Part of the reason why we're able to grow as quickly as we did, and we're still growing, there's a lot we have to get done, is because of the mentors I've had. Like, I would not be where I'm at right now without some of the mentors I've had in my life, and some of the mentors I continue to have in my life, and some of the advice that they give me. And I think at the end of the day, kind of paying that forward is very important. In my team, I kind of like often tell my teammates this. I end every sort of like interaction, every meeting, every personal meeting with my teammates with from a 0 to 10. Tell me how you feel. 0 being like, I'm cripplingly depressed, I'm anxious, I don't want to wake up this morning, to 10 being like, I'm a bird, give me the next project, I'm flying, right? And so at the end of the day, my notion is that their problems, be it personal or professional, are my problems. But my problems, however, are not their problems. So in that way, kind of by building internally, you kind of empower a team to move forward to make sure that you have external impact.
Okay, great. Sarah, would you like to try to address that? You know, any advice you have for entrepreneurs building technology-driven solutions and how they demonstrate social responsibility?
Sure. So, I mean, just exclusively within healthcare, you have to think about that end user and how you can help them and measure that with really good outcomes. There's lots of people that have great ideas, but you have to bring all the key stakeholders together, the customer, the patient, the person implementing that, the provider, and that could go across a wide spectrum from anywhere from a physical therapist to a physician. And you have to really listen to their feedback, and you have to do that or build that in a diverse population. So one of the things we loved about what we did at Mount Sinai is that we sit at the intersect of some of the poorest and the wealthiest people in the United States. And our cultures are very diverse, and so is the payer mix. So we got a lot of feedback. You have to have thick skin. You have to listen to that criticism. If you really want to build something that's meaningful and can actually help somebody, and that I think if you're getting into health technology, like the other speaker, it's not about money, it's about helping people.
Absolutely, absolutely. Sarah, I'm going to stick with you because I want to ask a question specific to challenges you may have faced as a woman in the innovation space. You know, was there anything unique to that? Because we're talking diversity here, and was there anything unique that you see or you express? And I'll come to you, Ivelyse, as well. But I wanted to ask that question on you.
So I've thought about that a lot, and I think actually a lot of the barriers or restrictions I put upon myself. And I had to pause and take a deep dive into what I was doing in different situations. You want to be confident, but not confrontational. I try to really think about, in terms of not only mentoringship, but finding sponsors. And I had to stop that a few years back. Instead of looking at different people that I could grow from, instead looking at a unique set of people that could help me rise and we could rise together. So anybody that's ever putting a barrier in your way or they have some type of preconceived notion, like, move on. You don't have enough time for that. So just do what you know is good. Always be on the right side of the law, and you'll,
Very important.
especially in healthcare and technology. And then following outcomes, you'll be fine.
Okay, great. Ivelyse, you want to take that? And also, you know, as a woman of color, the
Yeah,
challenges that you
I mean,
express.
and guys, I'm an Afro-Latina, means like, I'm from Puerto Rico. My dad is black. My mom's a little bit more on the fairer side, but when I started this, I talked about my early experience, right, when I worked for Genentech Roche. There were women there, but I was definitely one of the only women in the room. I then went into health tech, and in each of my companies, I was the first woman hired, the only woman there, and again, the only person of color, the only black Latina woman. I'm also was probably one of the only people who came from poverty, where I was supporting my family. So when I started Radical Health, I had this great idea. My first tech company, we had an exit. The second company, we had multiple. And so an exit means we sold the company and we had raised venture capital and we had sold the company. The second company, we had multiple term sheets, which means people wanted to invest millions of dollars in this. And in all of those, I did all of the client work. I had all of the product together. Essentially, I was doing it and running this company. So when I started Radical Health, I was like, great. I'll be able to raise some money for this incredible idea. I've done it before. I'm super successful. I know what I'm doing, and we're actually going to have impact for the communities that need it the most. And so when I went to raise money, people laughed at me. And I was told that I needed a white man on my board or on my staff. There was no way that I could raise. And over again, I kept getting hit, with these barriers. And I was like, well, what's going on here? I'm fully capable. I know that I am. Y'all know that I am. And what it came down to was when we look at the numbers, women especially do not get as much funding as men. You add a woman of color, we receive, less than, I think in healthcare right now, women are receiving about 20% of all funding in that digital health number that Rock Health put out. And they're actually doing a pretty good job now of looking at the numbers. But we receive a fraction of all funding that's distributed. And so then, basically I was just told I couldn't do it. And so I had to get really, really creative in how I found money. And so it essentially turned into, like you were also a for-profit, but we're a benefit corp. I incorporated that way because I wanted to make sure that when I brought on shareholders, that we made sure that first and foremost, our impact was at the front line. I am the first Latina-owned benefit corp in New York State. I had to crush a lot of barriers. We still have not taken any outside money, but I run a profitable business, which means, we generate revenue. I hire folks from my community. We built our own tech with our profits. And so it has been a challenge. It is a challenge. There's not a room that I don't walk into where I don't count how many people of color are in the room, how many women are there to this day. And I would say my advice for the women, for the folks, there is an element of just perseverance. If you know what you're doing and you know that you're doing it well and you are creating impact and change, do not stop. Do not let anyone take that away from you. The other thing is, you can only last on that for so long, is build a crew. I'm gonna say it again, I'm from the Bronx, right? But what's super important about being from the Bronx is that you have families, you have crews. If your family life is not as stable, right, you have friends, you have cousins, you figure out a support system. And I would say that if you're starting a company, if you're in med school, if you're doing residency, whatever your place is, whether you're going to work, find a crew that will support you, that will, be your eyes, be your ears, someone can set you up and you can take the shot. But the way that we've done this and the way that I'm super successful, it's not just by my own merit, by my own grind and hustle, but it really is about the crew that's around me. The crew in this room here, this panel, the folks on the DIH team, where we all just we see what we need to do and we support one another.
That's powerful. And that goes back to something Dival said. He spoke to that very powerfully, and that's a really good point. Gil, you want to speak to that, early on?
Yeah, I do.
Challenges?
I do, actually. I've been asked this question in different settings. And so I have two things about this that I feel pretty strongly on. So one is, we've raised a significant, depending on your perspective, amount of venture capital, about $20 million to date, and it's enabled us and allowed us to grow the business. And we're for profit, and we believe in building a sustainable business, and so we've made that conscious decision. And at the core of what we're doing is this supports the base of the pyramid up to the tip of the pyramid and all those great things. But the venture capital piece was a slug, and there are a few articles. There's one in Fortune magazine that where people asked me about it and asked me about kind of the whole process around it. And I was pretty transparent about, there were some people that were ready to invest until they actually met me in person. And I've had enough interactions with venture capitalists to I know when they're ready to write a check because they want to, or they're passing because the business doesn't make sense for them. And this was one of those ones where your spidey sense can tell you there's something else up here. And my co-founder, he's from Spain, and very different lived experience, and came here. And some of you in the audience know him. And so they came and they looked and they said, you guys just aren't the right people to build this business, which is fine. It's their capital, they're a steward of it. But the underlying business, and we obviously did end up raising significant capital, the underlying business didn't change, right? If we hadn't been able to raise capital in that money, it wouldn't have changed the underlying opportunity, and we've done 4x growth in 1 year. None of the fundamentals changed. It was just that the ability to raise capital was kind of hamstrung. And thankfully, we did get the capital we need to grow it. But it comes to my second point, which is, and I think what you said is really powerful. Investors are pattern matching. And so they're pattern matching, but I think in our case, they pattern match off the wrong things. They look and they say, all right, you got the X experience, you got this thing, you've got these Ivy League degrees, so you could be somebody that we'd take a look at, or you've had successful exits, you do this, so you could be interesting to us. That's actually not the thing that's made us, I think, the most successful, and not that we're wildly successful, has been that I'm the child of two immigrants. constantly been kind of discounted. We've constantly been in rooms where we've had to kind of persevere against different situations and odds. And it's actually that thing that actually, and you look at the percentage of businesses that are founded by immigrants, it's that lived experience that actually allows you to be more successful in what will always be a really, really difficult experience of building a business. It's not the fact that you've had these jobs or you've gone to those schools. Like, those things are great, but there's a threshold at which, you know, you can find smart people. It's the fact that you have the grit and you have this kind of willingness to run through walls and this chip on your shoulder that actually makes most entrepreneurs successful. So I actually think it's a fundamental flaw in the venture capital model that they're pattern matching off of all of these things where, I don't know what the numbers, probably 1% are women, you know, the percentage that are people of color, the percentage that are women and people of color don't even show up on the, in the statistics. Yeah, they're pattern matching off of, I think, kind of fundamentally the wrong metric. Because I've lived it enough to know what part of my experience is the thing that actually is enabling us to succeed. And it's not the Ivy League degrees, it's not the, you know, jobs and whatnot. It's actually the grit and the kind of chip on your shoulder, which you actually get more of from these groups of people who have been discounted, who have had to have those experiences, and who have essentially always had to fight for the next thing that they needed to get.
Yes, absolutely. Okay, I have one last question that I'll give to each of you, and then we'll have a brief Q&A before we move on into the program. And I'll just go down the line. I'll start with you, Clayton. And this one is really important to what we're doing here today in DIH. If you could comment on how a partnership with your organization might contribute to advancing the goals of DIH. You know what we're doing here, and what is it that you do what's the connection between what we both have and what we can pull together and bring everybody in this room along with us?
Well, if you're interested in advanced technology that has humanized it, Silicon Harlem is your company. And if you need space to work out of, Silicon Harlem's your company. Because DIH is going to need that innovation lab, if you will, to come up with great new ideas. And if space becomes an issue, actually we have it, so we are more than happy to work with you on that. But most importantly, I think our common value is how do we get more people. I was with the president of City College last week, and I was there because he was very nervous about his medical program. And the City College has the most diverse students in the country that are trying to get medical degrees. And it's in a real problem. And so I was able to get together with a lot of people that were going to try to definitely make sure we save that medical program, because the pipeline to Mount Sinai, the pipeline to any medical field must be inclusive. And City College has been very much devoted to that for many, 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 many years. And some of the great minds have come out of there and are still working in places like this. So I think our common ground is how do we ensure that we can keep these type of efforts in place, funded, and that it's creating a better world for us all, right? So that's really the connective tissue.
Okay, great. Ivelyse?
So I mean, I think, you know, I have a business that I run where we do workshops, and we have an app that I think, you know, people in the community could benefit from. So we can talk. But I think really what Radical Health offers, we build community. We do that with intention. We do that with connection. So as far as DIH and what you're building, I think that there's a real opportunity for us to build community together, to incorporate and to bring in people. We talk a lot about this top-down healthcare, but what we really believe in is people-led, people-powered. And so working with Radical Health, we get to bring in people's voices that don't usually get to come into spaces like this. There's a quote that I always lead with that, you know, I'm living my ancestors' wildest dreams. And I think, you know, I can tell you this much. my aunt lived on 106th and Park right over here. And I don't know that they ever imagined, my great aunt rather, and my grandmother, that I'd be sitting here today in Mount Sinai on a panel. And so what Radical Health gets to offer really is to bring in folks who I think deserve to be at this table, deserve to be on this panel, who can talk about their experiences. And that way when we create and we design and we build together, we're truly doing that together. And so I think, we definitely offer that. And I think we offer, again, as a Latina, as an entrepreneur, as an Afro-Latina specifically, as an entrepreneur in this space, I think the ways that Radical Health can support is, how do we get more women into positions of power, into positions, leadership positions? How do we support, the MDs, the med students, the researchers into the Dr. Butts calls it the MD plus, is that right? Or the Doctor plus role? But how do we create visibility and representation and real meaningful partnerships?
Great. Tanvir?
Yeah, I guess with my experiences, I kind of envision DIH as something that I would have wanted to do years ago. I mean, growing up in a South Asian household, everything was really binary, right? It's either white or black. It's like doctor, lawyer, engineer, end all, right? Nothing beyond that. But the truth is, like, growing up, it's like I noticed that, like, I had a passion for far too many things. I wanted to jump into things like fashion. I wanted to jump into things like technology, jumped into, Infor, cloud-based ERP systems and what have you, jumped into finance for a bit as well. I noticed that, like, at the end of the day, the thing that really intrigued me the most was impact. And so, funny enough, we're talking about City College, talking about the, the medical system over there. I graduated from City College. And so, kind of in that track, it was weird because, like, I knew that I wanted to do so many things, but the problem was that kind of going ahead and doing it was difficult because paving my path was hard, right? I had this passion for technology, which was like boundless. I wanted to be able to innovate and create something of scale. At the same time, I was ridiculously passionate about healthcare. I was a pre-med student. And so being able to intertwine both worlds was ridiculous. I remember as a freshman, some semester, I was literally voraciously interning, health tech startups, because I heard that was like the newest thing on the block, and I wanted to be able to jump into it. And so I literally had to scrap up any and all relationships to be able to get myself into one. I remember through some of the stuff that, that was happening at AAMC, I met some people at Cornell. They connected me to some guy who graduated from Presbyterian, went to McKinsey for a bit, started his own health tech company. And I was like, you know what? No. I have to meet this guy. And so I jumped in a call. I don't know what I said. I was like, hey, I'm into healthcare. I went to Nicaragua for a bit. I did a service mission, but I like technology. I'm at Info right now. Give me a shot. And so kind of from there, kind of cold calling my way through, I was able to sort of like just get up the totem pole, and kind of mustering my way and getting a health tech position there was what I had to do to jump into the space. And knowing that we're building something like this for other people like me who are interested in health and technology and the myriad in between is amazing. And there are moments where I feel as if like I kind of wish I was still a freshman in college, so I'd be able to acknowledge this and sort of jump in and be a participant. That's one. The other thing was that Errunds, we're an AI-powered online community marketplace, and we are creating technology that will more or less reshape neighborhoods. We're building a smarter city, and we're in talks with some cool people at the EDC right now, working on some really awesome partnerships. More recently, shouts to my biz dev team, doing some phenomenal work. We're in talks to partner up with Columbia Data Institute to bring on some AI developers onto our team to more or less work with our engineers and what have you, and leverage the technology that we have. At the end of the day, it's a win-win for them because primarily the students end up getting first-hand application and using technology to solve urban problems. We end up getting Columbia talent, so go figure. At the same time, I feel, I want to sort of extend that to medicine, to Mount Sinai as well. Being able to sort of like have med school students on our team, not only be able to sort of like, tell patients, hey, you have to eat better, but also be able to show them how to do so as well, show them where to go, have interconnectivity, show them accessibility of resources. I think that's something that, the average physician, the modern physician would want to know how to do. And more importantly, developing skills, becoming more agile, thinking micro and macro, right? These are things that we're passionate about at Errunds, and it's something that I'd love to sort of extend to DIH and Mount Sinai.
Great. Sarah, you're already in the family already, so.
Yes, sure. I mean, I can talk about Mount Sinai all day. 40,000 employees. We just bought our 8th hospital, and we have the most named, I think, diseases after Mount Sinai physicians. So you're really at the intersect of an amazing institution.
Yeah.
So, the DIH team, they've been fantastic. They actually reached out to me because they're innovators, they're breaking down barriers, they're running through those walls. It's a smart, fantastic group. You want to work with smart, fantastic people, is definitely smart. And we have that here, and we also have a great population for you to look at the different innovative things that you want to do, and in a very supported, structured place. And you kind of need that sometimes as you're innovating and learning, to have other people to rely on, to talk about all the different ideas that you're generating, to see if they'll really be useful. You don't want to waste your time either. In terms of Lab 100, we would love to partner, hear what innovative things people are doing. If anybody wants to take a tour of the space, go to lab100.org. You can email me. We're a small, scrappy team of 2 or 3 people trying to do this, but we'll fit you in to take a peek, at it, and it's amazing. I feel like it really sparks a lot of people's creative juices to see something like that. So be more than happy. And again, Mount Sinai is a fantastic place, and the team is wonderful to work with.
Thank you. Gil?
Yeah, just I'd say a couple quick thoughts on it. So I think this is phenomenal. I think the idea of bringing this ecosystem together, I think when you can do this, and Silicon Harlem people know this, when you can bring all these different parts of the ecosystem together, you can do some really powerful things. To really build an organization, you need to have access to the talent, you need to have access to the capital, you need to have access to a ready customer base, and you need to have kind of an ecosystem that's generally supporting and promoting you, because if you do all of this under a rock and nobody knows, it doesn't start to amplify the impact. So I think bringing all these things together is really powerful and really exciting. The few things from our perspective, selfishly, our offices are in Soho. I know some of you guys have been there, but we're hiring. So if there are people that are here that are interested and could be potential roles, we're obviously looking to grow. So we support different physician groups and health plans. So we're always looking for customers in the space. We're looking for folks who can help us through. We're starting, I'm not a physician, my brother's a physician. We're starting to put together a set of clinical advisors, I think it's Clinical Innovation Council, who can help us start to innovate faster. I love the framework you had there around basically allowing us to iterate quickly. So if folks are looking and interesting and getting involved in that way, and then however we can help and contribute to the ecosystem as well. I think it's just really powerful to have all these different parties together, thinking and moving in concert.
Excellent. Please join me in giving a warm round of applause. Excellent panel. A lot of good information. Thank you so much. Thank you for supporting DIH and the Mount Sinai Health System. Did we want to take a few questions? Did anyone have a few questions before we move on? Yes, we have could you get the mic? There's one over there. There was a gentleman right here, Mary, right there. Right there.
Right here first.
Okay.
Thank you so much for being here. It's really great to hear all of your diverse perspectives. So I want to circle back to a point that was brought up about tech access. So I think technology is great and it lets us do all of these things we weren't able to do years ago, but there was a point that was brought up about tech access and how it's not always equal. So people, they don't always have, if people may live in internet deserts, especially in rural areas. So my question is around, aside from advocating for and building this infrastructure, what can we do and what strategies are there to get our innovations to the communities that may need them the most?
Ivelyse, you want to take us out of that?
Sure. I mean, I think one of the things that we're doing, so there was a Pew Research study that said 87% of folks who live in poverty, their primary way of accessing the internet is via a smartphone. We recognize, right, that like internet accessibility isn't always there, but we do know, and at least for us at Radical Health, what we're doing is we have an app, but we're building out an SMS and a WhatsApp integration, and essentially we're just chatting, right? So we know that people do stay connected. We try to think about what are the ways that people are connecting with their loved ones, and kind of what they're using on a day-to-day basis. And so for us, it's through SMS and WhatsApp. I think it's very real, and I think I'd be remiss if I didn't say, there are challenges. I think what's important is the intention behind it, and again, that's why we also have the people component, because we don't think tech alone will solve it. People will be left out. But when you start to incorporate the people component plus the tech component with intention, really that's how we see true connection and as much inclusivity as possible.
Clayton, you want to briefly speak?
Yeah, let me try to directly answer your question. Everyone must have a connection in the home. If you go around Harlem at 3:30 and you see the kids get out of school, going to a Starbucks or a library on a phone trying to get an essay done for their homework, they go straight to play. It's impossible, and there's something wrong with us if we let that happen. So to your question, the great news is that new technology is now coming upon us to where we can bring infrastructure into every home, even in the rural areas, because wireless connectivity has become stronger and a fraction of the cost. And that's critical to infrastructure across the board. And one thing I would ask, even here, and nobody will raise their hand, but does anybody know who the chairman of the Transportation and Infrastructure Committee of the United States Congress? Exactly. The guy has $2 trillion. And it's not going to be for just simply streets, bridges, and tunnels, but it's going to have to be broadband infrastructure. So as I said before, we can talk about all these cool things, but if even one home does not have internet in it, it will not be a smart city.
Yeah,
And I told that to the mayor himself.
Okay.
I mean, I'll
I'm
just say
dead serious.
with Lab 100, when we built it, we definitely thought about the iPhone, that everybody has a phone. So we give everything transparent. The patient gets all their results immediately, and then at the end of the visit, we give them a health report card. And we immediately thought, as patients came through, we did not build this for throughput. And a lot of feedback was this needs to be deployed in the rural areas because it would do a lot better. There's a ton of hospitals in New York City. It's not the same across the rest of the United States or even globally. And there's a lot of global issues that are on the rise, smoking, diabetes, so you have to think about those things. So we thought, to your point, tech-enabled, you have to think about rural areas, how can you deploy it, scalability, should it be on a flatbed truck, down to a kiosk? So we thought about all of that and giving patients the information, but they have to have a lifeline or a connection back to an academic institution or a hospital system so that when things become identified, they have a feedback mechanism to take it to the next step.
Excellent. I think we had another question over here.
Yes, I have a question. I would compliment all of you. I think you've done fantastic work, and you deserve all the applause of all of us. But one of the things that worries me as a citizen, one cares about health care, is most of the major hospitals in the country depend upon, they get 60% of their income really comes from Medicare and Medicaid, and the balance of it comes from private sources. So if there is something on the horizon which is called Medicare for all, and the lack of infrastructure is indicated, such as in California, how do you see this without the proper infrastructure? If there is Medicare for all, and what would your role be as you envisage it?
Gil, you want to take a shot at that?
Sure. I'm not going to wade into the politics of plus or minus positives and negatives around Medicare for all, and there are different versions of it. But I think it's an awesome question. I do think that there will be, I'm speaking as Gil here, I do think that there is and will be some contraction in terms of there is probably more infrastructure in place in healthcare in certain areas than there should be for a cost-effective, efficient healthcare system. So I do think there are some places in some parts of the system where there's overinvestment, and I think that there are some parts of the system where there's underinvestment. And I think that as you start to move towards more value-based care, you can start to better allocate resources between those. But I do think there is necessary core infrastructure that you need to have across all parts of the country, so that the experience that you have here in Upper Manhattan isn't dramatically different than the experience you have in rural Kansas, for example. And so you need to be able to have enough revenue coming in to support a healthcare system there. When you move towards, there are various parts of Medicare for All. When you move towards that, you take away one area, which is the insurance piece. So you don't have some people in this area have insurance, some people don't, some people have better commercial insurance, some people don't. So you do take that one threshold away. So there is the positive in that you start to put a blanket level of coverage for everybody in the country, which allows you to allocate infrastructure resources better. I think the challenge is that we moved to an employer-based system, and there were reasons why we did that, and some of them are positive, some of them are negative, but it takes a really, really long time to turn the wheel, and then you end up with these period, which I think could be 10, 20 years, where you just don't have the necessary infrastructure. If you go from employers no longer have to pay, but it takes a little while for the government to ramp up, you end up with this period where there's underfunding, and I think that becomes really dangerous. And so making sure that you can essentially build a bridge between what you have today and what the kind of vision of Medicare for All is, I think is kind of the thing nobody talks about. I just think it's really, really hard, and we've seen enough, and there are people in this room that know more, that it's just really hard to move the system. And in that intervening period, I think you'll end up with challenges with the infrastructure that people haven't accounted for. Does that answer your question?
Well, I guess the question that what concerns me is that if there is Medicare for all, how's it going to get paid for? And during this infrastructure endowment or whatever it's going to be before it gets into place for 10 years, 15 years, whatever, what's it going to do to the health system as we presently have it? Is it going to deprecate everything that's been accomplished because of the additional coverage and the funding that's not going to come from the private sector, and it's going to be the government, it's going to be politics?
Yeah, I think I share your concern on the second piece and how you bridge that gap.
Okay. We got time for one more question before. What, you got one? Yeah, great.
Yeah, just thanks again for all of the folks on the panel. I'm specifically curious for the founder's perspective in the room on like when it makes sense to raise venture capital. I guess specifically in healthcare, it seems like technology might not be always the right solution for a lot of like the hairy problems that we have in healthcare. And for someone inspiring founders in the room, like especially if you're a person of color, like when it makes sense to actually raise venture capital and go after some of the more tech-oriented ways of building a company.
Tanvir, you want to grab that?
Yeah, I just wanted to jump this one real quick. So the whole notion in VC funding is that, typically oftentimes people are, on the news, Forbes, what have you, if they raise a ton of money. And so you feel as if to start a startup, you have to raise money. So we kind of have this myth in the back of our minds. But after kind of starting one and seeing it for a while, the rule of thumb is don't raise unless you have to. That's just the way it works. And typically when it comes to, building and starting up from bootstrapping early on, I think we were talking about this a while back, friends and family rounds are great if you really need capital to build something. Sort of relying and over-indexing on accelerators and incubators are also pretty awesome as well as a means of just getting your idea out there. But essentially just that, get your idea out there in any way possible, right? So at the end of the day, it does not have to be a technology company, right? So oftentimes we feel as if to make a startup, you have to be a tech company. You don't have to be a tech company, right? So you have to literally look into the pain point that you're trying to solve. Find a very unscalable way initially. That might mean you physically doing all the work or sort of having a group with you doing all the work. And then over a period of time, as you start envisioning ways to scale that up, that's when you implement technology. But by that time, you would have a ton of data as well. So then you'd be able to raise a lot more effectively if need be. But the rule of thumb is unless you have to, don't raise. And when you do raise, make sure that you have enough data to prove your concept, de-risk your concept, and to validate your concept as well. That way you end up having a larger piece of the pie without dilution or what have you.
So Ivelyse, sounds like you struggled with this a little bit. Y'all let you.
I'm still struggling with it. Honestly, I wanted to raise early on. I didn't. Then I'm like super stubborn right now because now investors, they're circling like sharks because we have money, and now it's my concept is proven and they want to invest. To be completely honest with you, on any given week, I go back and forth between should I raise, should I not. And the truth is, the benefits for me raising right now is that I get to scale, I get to do this work, I get to do it in more states with more impact. That'd be great. I think, to your point, it's, raise if you have to and you need to. And I think the other thing that I would offer you is there's nothing better than generating revenue and making your own money. So you don't need to raise. And there are other ways too of getting money in. So whether that's a loan, whether that's grants or, non-dilutive like the accelerators, there are other ways to get money. I believe that there's enough money around. I will say for the friends and family round, I don't have friends and family that can write me even a $5,000 check. So, I think that's something, being a founder and starting a company, you have to employ some sort of privilege. And I think acknowledging that it's not going to be equal for everyone else. But there are ways to go around it. And then, if you're going to raise, I would say I treat it like I'm getting married. So if I'm raising from someone, we're going to date, we're going to hang out. I want to know what you eat for breakfast, before I fully commit to you, because then it is that kind of partnership. So make sure you're raising and you're taking money from the right people.
Sort of add on to that, that was a great point about marriage. Funny enough, I think the average marriage in America is less than 10 years. You're going to have a VC in your cap table for 10 years, if not more. So yeah, do not take that lightly at all.
Okay. No. We just we need to move the program forward, and we're going to have a networking session afterwards where you can, everybody's going to be around, and we can,
Can I just say one thing?
Okay.
You shouldn't not raise because you're a person of color. Hopefully that didn't come through. You should absolutely go out and raise capital if it will help accelerate your business, and that's for anybody.
Everyone at this table has raised money. So.
Great.
All right.
Okay, well, let me just wrap this up. Thank you all. This has been very, very informative. Please thank our panelists. And remember, we are DIH, all of us. So as Davil said earlier, think differently, get involved. These people have told us just push it forward and keep going and keep it moving forward. And I think we can all make that change together. Thank you very much.
Thank you.